a presentation, I'm going to talk to you about being a nurse practitioner. So it is slightly convoluted when it comes to being a nurse practitioner, because a lot of people are confused. Are you a nurse? You know, who are you? And this is why I'm here today, so that you guys know what it is, what the job entails, how much education you need to do this type of job, what it pays, and what kind of other career avenues you have as a nurse practitioner. So at any time, feel free, if you have questions, let me know. If you can't hear me also, because that happens as well, let me know. If I'm talking too fast, also let me know, because that has happened before. My credentials read DNP, APRN, FNP, BC. That's a lot of letters. And to just basically break it down for you, is the first credential is my degree from the university that I finished, which is a doctorate. The second, APRN, is my license from the state of Florida. And the third is a certification, aka specialty, right? So what do I specialize in? I'm a family nurse practitioner. And when I talk to you a little bit more about the type of education we have to receive, you'll see that there are different specializations that you can go into. You don't have to be a family nurse practitioner. There are other options available. So, you know what, why am I doing this? I did the whole pretty transition and everything, and I'm doing that. So the route that I took is rather a traditional route, I want to say. I went on 15 months of ADN program, which is an associate degree program, a 2-year college degree from Miami-Dade College. Why I did that is because I didn't have no money to pay for my schooling, and that was the cheapest option available. It's cheap, yes, but the program is a harsh program. You do have to put in a lot of work. They have a ton of applicants. That's why they select the cream of the crop. They are very picky with their, who they pick and who they admit, because they have so many applicants, because again, it's cheap. So that's why everybody wants to get in. At the same token, I did get a full scholarship from Baptist Hospital, which is one of the biggest systems here in South Florida. They did pay for all of my education. I did receive a internship while I was still in school with them, which was a paid internship. We had to work 1 day a week to get more experience, more hands-on experience. We were shadowing a nurse. We were really getting our hands-on experience through that scholarship opportunity. And unfortunately, they were supposed to give us employment, because that was part of the deal. We're going to pay for your education, but then you're going to have to work for us for 2 years. Unfortunately, when I graduated in 2012, whole of South Florida went on a hiring freeze. And what that means is that there were way too many nurses finishing school and not as many employment opportunities. So therefore, a lot of my classmates ended up moving out of town. Some people moved to Orlando. Some people moved out of state completely. And some people stayed, stuck around like me. Eventually, I did get a job, but because of the hiring freeze, I was not able to work for Baptist systems. I ended up working for Mount Sinai later on. Not something that I regret. They still paid for my education. I'm still very grateful. But just goes to show how fluctuant the whole employment system is. The whole what do you call it? Like a I guess labor economy, if you want to say that. If there's demand, there's obviously should be a supply, right? But then if the supply is bigger than the demand, this is what happens. People go on hiring freeze, and it's hard to find a job. And then think about all those people who took out loans, right? And went to school. I didn't have to pay anything, but the people who had loans, they had to still pay their loans, and they couldn't find a job. So things like that do happen. The situation right now with COVID is totally completely different. Right now, everybody's hiring. Everybody wants nurses because of the shortage, right? But imagine, things can change like that real fast. So that's something to keep an eye on. Then I decided that I'm not gonna wait, and I'm gonna go ahead straight back to school and get my bachelor's degree. I did it at the same Miami-Dade College, again, because of the price, but then ended up Mount Sinai ended up actually paying majority of my bachelor's education because I was employed by them at that moment. I really wanted to stop there. I did not want to get any more education after that. I was so tired of school. I was really wiped out. I had a child right before I started the nursing program, and she was still little. She was still requiring a lot of attention. You know how kids get sick all the time too, and you have to, you know, really tend to them, and then you have to work, and then you have to go to school. It was really difficult. So I really wanted to stop there. But at the end, at the last semester of my bachelor's degree, they had us do leadership. And what you do with that, you meet a nurse with a higher education and you learn about different types of opportunities that there are in your profession. So I met with a couple of wonderful human beings that were absolutely inspiring to me. One of them had a master's degree in leadership, actually, and she was working in a hospital as a director of nursing of one of the units. So her job was to oversee the whole unit, see how everybody's working, you know, do payroll, do scheduling, you know, work out issues if there were any issues, and so on and so forth. Budget, like it was a lot of basically administrative work that she did. And another one was a nurse practitioner, and she was a pediatric nurse practitioner, and she also gave me another perspective into actually what I'm doing right now. Obviously I've heard about it before, but I never really known anybody, you know, firsthand like that. And that her experience really helped me make a decision. So I went back to school again, not very soon, actually very soon after graduating from bachelor's. 2014, I graduated. I think I took like about a semester off while preparing all the documents for admissions and everything. And then I went back to school to Florida International University. So I wanted to get a master's degree in nursing to become a family nurse practitioner, right? So, but by the time I applied, when I went there, they have started this new hybrid program where you could get your doctorate in a shorter time. And they said, you know what, you know, this is gonna be saving you money, this is gonna be saving you time. Why not go to school for another 4 semesters and then you have a doctorate? Guess what, you know, then you're done with school forever, because it's a terminal degree. There's nothing higher than that. And I thought to myself, and I said, well, I'm going to school anyway, right? Might as well just stick with it. You know, 4 more semesters doesn't sound that bad. It was bad, but but I didn't realize that, you know, at the time. So that's how I ended up actually doing the dual program. And at the end, 2018, I graduated with a doctorate in nursing practice. So what does that entail? I put that in here as well. So currently I'm working at a community health clinic, and I not only perform the job duties of a regular family nurse practitioner, but I also do see patients with HIV infection, and we treat them, we treat their HIV, we treat other conditions that they have, and I have a special separate certification in order to do that. But I did already, you know, kind of like on the job training, plus I took several other courses. That was not a requirement to become a nurse practitioner at all. That was something that I saw was needed, and that's why I did that. So NP as a profession, historically, we started erupting as a profession in 1960s because there was a deficit of primary care providers, and that happened because all of the doctors all of a sudden decided to specialize. They said, you know what, why would I be a family doctor making X amount of money if I can be a cardiologist making XXX amount of money, right? So a lot of them started specializing and going into very narrow specialties, and therefore there was nobody left to actually do the primary care role. So that's why nurse practitioners became a profession. Loretta Ford, who is a nurse, and she had a doctorate in education, and Dr. Henry Silver, who was a medical doctor, they actually developed the first nurse practitioner training program, because before that, it was basically just on-the-job training. A nurse would be trained as an intern, if you want, with a physician, and then, you know, the physician would pass along all of his or her knowledge to the nurse, and the nurse would end up becoming a nurse practitioner pretty much. There was not a lot of formal education. There was not a lot of, a certification and or licensing requirement. It was kind of like, it just happened so, right? So in 1965, this is when they actually established the first formal education for them, with criteria, with, this is what you have to study, this is what you have to pass in order to become a nurse practitioner and do the job properly. So by 2017, there were 234,000 licensed nurse practitioners in the United States. So imagine from like 2030, right, in 1960s, it went into thousands. I'm pretty sure it's even more right now. Our main specializations, where can you work, is family, like myself. And family means that I can see pediatric patients, which means from day one, which I don't really want to, but if push comes to shove, I could. I can see adult patients. I can see geriatric patients, meaning older patients. I can see pregnant patients. Whichever one is coming my way, I can see them. Currently, right now, I only see patients from 18 and up, and I'm happy with that because pediatrics is difficult. It's very convoluted, not my cup of tea. I really praise those who can do pediatrics, which is another specialty. And I'm very thankful for them because they do a tremendous job keeping our kids safe and healthy. Then there's women's health that specializes specifically in, pregnant women, in pregnancy planning, and in women's health, GYN wise, if there's any infections or anything like that, they would treat that. Psychiatry is another specialty. Psychiatry can only treat psychiatric diseases. They're not supposed to treat your high blood pressure, diabetes, things like that. That's what we do. That's what family nurse practitioners do. Anesthesiology, which is another wonderful, wonderful field to go into, very highly paid, very highly skilled professionals go into that. A little more training, more, I would say intense training than what I had to go through. And this is why they're paid more. And this is basically an anesthesiologist, is a person who gives you anesthesia during procedures, surgical procedures, deliveries of babies, things like that. They can give all kinds of anesthesia. Total anesthesia, where you're completely asleep and you cannot breathe for yourself, they can do that. They can do spinal anesthesia, where they inject medication in your spine and you don't feel like half of your body, but the rest, you're awake and you can breathe for yourself. They can do all kinds of anesthesia like that. Gerontology is another small field, is basically taking care of older population, and acute care is taking care of people in the hospitals that are acutely sick, that can have, very bad traumas and things like that. That can be in ICUs and all of that. So, but the trick with our profession is that you have to become a nurse first before you become a nurse practitioner. So you have to go through the training of a nurse first. And now it's a blessing and a curse in a sense, because nurse practitioners are different from, say, PAs. You probably heard about PAs, right? Physician assistants, or now they call them physician associates. Is that physician associates can come from a different field, economics, teaching, whatever other field. They can come from that field, study for 2 years, pass their exam, and treat patients, see patients. Whereas nurse practitioners can't do that. We have to be nurses. We only can be nurses. So, and that is a blessing in a sense that while you're going through your nursing school, when you start working as a nurse on a floor or, anywhere in a hospital, anywhere that you want to work, you are gaining experience. You are gaining so much knowledge that's going to help you in your future career, that it's really, you can't put a price on that. And the PAs, for example, yes, they're also great professionals, but they lack that part of being a nurse. They don't know a lot of the minutia, a lot of the little nuances that we do, because we've worked in the hospitals, we have seen different situations, we know how certain things work. And that sets us apart. Minimum education requirement for entry into the profession of nurse practitioner is a master's. To become a nurse, you only need an associate degree of 2 years. So that's the difference between that. You don't even have to have your bachelor's degree. But it behooves you to have that, because then you're a better candidate and you can ask for a better pay from your employer. And the terminal degree, there are mainly 2 terminal degrees for nurse practitioners. There are either doctorate in nursing practice or a PhD, because we do have that. So the PhD deals more with research, teaching, more academia wise, whereas the DNP is a doctorate degree for nurses who are more into actually practicing medicine, if you want to do that. So that's why we have two different educational doctorates. But basically both of them are recognized and both of them are equally doctorate. There's not a difference in that, in like prestige or anything. Job duties and benefits. So what do I do on my daily basis as a nurse practitioner? I work in an office, so we don't see, really sick patients. Most of our patients come to us to the clinic, walking on their 2 feet. I assess them, I diagnose them, I listen to their complaints, and then I do my assessment as far as I listen to their lungs, heart sounds, bowel sounds, and I develop treatment plans for them. So I diagnose, I tell them, this is what you have, this is what we're gonna do for it, and if that doesn't work, this is what we're gonna do for that. I order laboratory and imaging tests. If they need blood work done, I can order that. If they need any CT scans, chest x-rays, anything, MRIs, it's within my scope of practice to order that. We also provide preventive care, which is a big deal, because we want to keep our patients as healthy as possible. So we counsel them on the diet, on exercise. We counsel them on what type of vaccines they need and when, because that differs throughout life. So you have to be knowledgeable in that. And we base our recommendations also based on the patient's laboratory findings. Say, for example, if your sugar is too high, but not high enough for me to order medication, I tell you what to do. This is how you change your diet. This is how you change your activity level in order to improve this. What did I do? There you go. If we need to, we refer them. We refer our patients to specialists for evaluation and care of special conditions. So if there's something that I feel that I cannot control, and I cannot help this patient, then I can definitely refer them to a specialist. If they need surgery, if they have a really bad heart condition, if they have kidney problems, we obviously refer them to the needed specialty. In the benefits of working as family nurse practitioner, there's almost no work on the weekends. I work one Saturday every 3 to 4 months, but that's within my contract per my employer. Not all of us do that. Some of us work no weekends at all. But again, that's because I work outpatient. I don't work in a hospital. We get federal holidays off, again, because I work outpatient. We have paid time off, and those benefits do differ from employer to employer, but I'm giving you like a ballpark of that so that you understand what you might get. You get some personal time, you get sick time, you get CME time and reimbursement. CME is a continuous medical education because we do have to continuously educate ourselves on the new findings and the new treatments that are available for different diseases. And in order to do that, we do have to do that for our licenses, for our certifications, and my employer gives us 5 days a year to do conferences, to do educational activities, and then they pay for some of it as well. And then the good thing is also we can see a wide panel of patients as a family nurse practitioner, again including pediatric, pregnant females, adult population. I don't see pediatric patients because I don't want to, but if I had to, I could. And then money and potential, right? Everybody wants to know about money. How much money can I make? How much money is that going to bring me? So Florida, potential-wise, Florida has accepted a fully autonomous practice by primary care NPs who meet certain criteria. What does that mean? That means that I have met those criteria, which criteria is to have worked 3,000 hours after receiving your license, to have a clean license, meaning that nobody's suing you, you're not under investigation for doing something wrong, and plus you do certain educational requirements and you can apply for that autonomous license. So I have applied for it, I have it, and that means that if tomorrow I win a lottery or something and then I have enough money to open up my own office, then I may. I don't need a doctor for that. I don't need anybody else for that. I can be the owner and the medical director of that office, and I can run everything in that office. 21 states throughout the United States have accepted that into law. Obviously, they differ slightly from state to state, but 21 states have accepted that and already have nurse practitioners owning their own businesses, offices, and so on and so forth. So for a family nurse practitioner from salary.com, beginners usually get about $99,000. Median is around $114,000, and then high-end pay is about $133,000 a year. Mind you, keep in mind that if you're working for somebody. If you're working for yourself and you have your own business, you have different avenues of income that you can do, that you can pursue, right? It's not only from seeing patients that you can get money. You can dab a little bit into aesthetics, especially, because it's Miami, everybody wants Botox. So yes, you can dab a little bit in aesthetics. You can actually do some teaching on the side. You can do a whole bunch of different things. So this is just a ballpark of what you can make working for one employer, and being an employee. Now, if you're a nurse anesthetist in Florida, remember I told you about that, with anesthesiology pays a lot more money because they have a lot more responsibilities. They deal with sicker patients. They deal with life and death situations because, every time you go under anesthesia, there is a potential that something can go wrong and you can die on the table. So that's why they have more responsibility. They have to calculate the dosages of the medications very carefully, consider different criteria. And so their pay is a lot more than our pay, right? So they can do anywhere from $163,000 a year to $226,000 a year. But again, their education is much more intense. They have to go through 2 to 3 years of taking about 8 classes a semester, whereas we take about 4 classes a semester to finish our degree. They take about 8 classes a semester. It's very intense. It's a lot of chemistry. It's a lot of hardcore science, and they actually have you sign a contract that says that you will not work 0 hours. You cannot work at all throughout this educational program because it's that intense. Okay, so not everybody can afford to do that. I couldn't afford to take 3 years out of my life without working. Having a child, having my family was not an option for me. However, if you can do that, if you have great family support that'll support you through that, definitely that's something to go for. It's very, very lucrative.